The following digital mental health training focuses on mental health care and technology. This brief tutorial is designed to help you learn digital mental health skills. It does not provide medical advice. It is intended for educational and informational purposes only. There are many ways to implement mental health care treatment. In this tutorial, mental health care treatment will be defined using 4 main points. Those points include meeting with patients face-to-face during clinical sessions, identifying need areas, co-creating goals with patients, and utilizing interventions during sessions in order to support treatment goals. Now let us take a closer look at how technology may augment this mental health care model. Applying the same framework as before, we see that technology can help minimize the disruption of treatment when in-person meetings cannot be conducted. This includes using tools like Zoom, Google Meet, and other teleconference options. Using technology does not need to be infused in every step of treatment. In this example, the identification of need areas and co-creation of goals is done verbally between patient and clinician. The last step, utilizing interventions during sessions to support treatment goals, is where technology again can become helpful. If a clinician were to use a mental health app, like LAMP, they may spend several minutes during session discussing the collected data with patients, which may help lead to a rich clinical discussion. Now let's take a closer look at some technology-created data. In the following example, we will use data created in the LAMP app as a focal point of the clinical discussion. This graph shows the step count of a patient over the course of several days. As we can see, there was a dramatic decrease in steps beginning on Wednesday the 18th. The data alone tells us that something of importance happened that day. However, without the patient's first-hand account, we do not know what that event could have been. Was the patient experiencing the increased symptoms of severe depression? Were they physically harmed in some way, or did they lose their phone? Since that data point marks such a dramatic change in behavior, the day was discussed during session and the clinician learned of a new health-related issue the patient was living with. That subsequently led to a deep discussion about coping skills, both past and present. As highlighted in this example, technology can be a vital resource, but should not be used as a replacement for mental health care with a trained, qualified clinician. This graph shows used properly, technology can augment mental health care by streamlining clinical data, strengthening the therapeutic alliance by minimizing disruptions of scheduled clinical sessions, and encourage patients to learn how their daily behaviors and moods may be connected.